going to say hello and welcome to the launch of the report, Knowledge is Power. And we really are delighted to share the key findings from the research that's been undertaken by PIF and Ipsos to understand health information and how it's being accessed across the UK, because looking at the four nations was really important to us. We don't want to be England centric. We need to make sure that we're covering the four nations. My name is Sue Farrington and I'm chair of the Patient Information Forum. And today I'm joined by Sophie Randall, who is director at PIF, and Rebecca West from Ipsos. But before we begin, the ever housekeeping notes, please keep yourself muted just to let you know that the webinar is being recorded and it will be uploaded to the PIF website. We do want to take questions and we want as many questions as you have, but please can you give those questions. We want to take questions when all of the presentations have been done. However, if you've got questions, please, you can put them in the chat or you can raise your hand at the end and we'll have that opportunity. And you can enable closed captions in the Zoom if needed. But before we begin, we just want to do a quick poll and we wanted to sense check with you. How easy do you think it is to find trusted healthcare information? Eugene, do you want to launch the poll, please? I don't know how long it normally takes for you to get the responses through. I suppose it depends how long people have to deliberate. Do they think it's easy or very hard?
Still got some voting going on at the moment, Sue. So I think if we give it another minute, I think about 10% of participants left to vote. So
okay,
I think now, Eugene, do you want to end the poll and share the results?
Okay, so 50% have done what I did, which was to go in the middle. And I think we had one comment in the chat which says it depends who you are, and that is very pertinent. But we will come and cover some of those points as we go through the webinar today. But before we get into the real meat of the session, I just wanted to provide a brief introduction to kind of set the background and the context for the work that we've been doing. As some of you may remember, back in 2015, which seems ages ago, PIF did a consumer survey, again, to kind of understand how people were accessing information and whether they could. And what we found was that people faced significant challenges. So 10 years on, we wanted to see whether anything had changed, had there been any improvements, what they were, and if there hadn't been improvements, what those challenges were. For me, this is my opinion, but I think that in the field of healthcare content, there are some givens. We know that there is a wealth of research to show that access to the right information at the right time in the right format can really help to deliver positive health outcomes. And when I say information, what I'm talking about is healthcare content that is evidence-based, accurate, up-to-date and accessible. But that's a bit of a mouthful, so I just shorten it to healthcare content, healthcare information. But alongside all of the research demonstrating the benefits, enshrined in the NHS Constitution is a person's right to information to inform their care. So with that as a backdrop, you might well expect access to health information to be pretty good. Oh, sorry, we haven't had the slides. That's my fault for not asking. So could we have the slides up? And I think we'll probably need to skip a few. Go to the next one. The next slide. And then the next one. So that's what I've just been covering while we commissioned. So this is about understanding the kind of current landscape. We understand that the world has changed significantly over the last 10 years. We've seen exponential advances of technology and ever increasing use of social media and AI. And of course, there was COVID, the global pandemic, which actually revealed an alarming rise in the misuse of information and disinformation. So we felt it was important to understand the current landscape and how that might be impacting on people's ability to access information, but also in their confidence to use the information that was around. And confidence in information is really critical. Confidence that people have to use that information. And that's critical for public people, patients, and healthcare professionals. And that's why PIF worked with a number of experts from across sectors to launch the PIF TICK in 2020. And the PIF TICK provides verification of healthcare information. Next slide. So the 2024 survey clearly shows that people recognise the value and importance of being able to access quality health information as part of their healthcare journey to help them make informed health decisions. But what you will hear with the key findings is that that isn't happening. And some aspects are getting worse. So what we need to do and what we feel we need to do collectively is to activate that right to health information. But of course, it's really important that we understand the backdrop against which we're operating and the implications that this may well have on the provision of health information. I think we're all very conscious that of the pressures being faced by our colleagues working in the healthcare system. Also noting that the increasing move to support people in local settings, not just in secondary care, may have an impact as to how information is provided. And the increasing shift from analog to digital, making sure that people don't get left behind. These are all factors that we need to bear in mind. Now, you're going to hear later from Sophie about the recommendations that PIF is making to ensure that the right to health information becomes a reality. But before we hear from Sophie, I'd like to hand over to Rebecca West from Ipsos, who's going to take us through the key findings.
Great. Thank you so much, Sue. So I think we can shift to the next slide. So first, just to give you some bit of information about the research and the sample. So as Sue already mentioned, we at Ipsos conducted this survey in partnership with PIF. We conducted a cross-sectional nationally representative survey with 2,003 adults in the UK from May through June 2024 using the Ipsos Knowledge Panel. And the reason that we wanted to call that out specifically is because of the Knowledge Panel as a tool and what it means for the findings that we're going to be showing today. So the Knowledge Panel is we recruit panelists or people to respond to our surveys using a random probability, unclustered, address-based sampling method. And before you say what, basically what that means is every household in the UK has an equal chance of being selected to join the panel. So this provides us with a truly nationally representative picture of the people living in the UK. And it's also, I think, important to note that with the Knowledge Panel, we do also include those who are digitally excluded. So if you're selected to join the Knowledge Panel and you don't have internet access in your home, we do provide people with a tablet and data so that they can participate in our surveys as well. And so again, this really provides us with a sample that is representative of the country at the current moment in public and is reflective of the UK public's opinion. Just a few notes on our sample. It was about 50% male and female. You do see 85% of our respondents were white and 15% kind of fell into the larger category of ethnic minority. We did have a fairly even split representative of the UK public across age. About 40% of participants had a health long-term health condition, and 62% had or did not have one, 62% had one. And as we mentioned earlier, we did also survey the 4 nations. It is nationally representative, so the majority of the sample is from England, but you can see that we also had representation from Scotland, Wales, and Northern Ireland as well. So that's, I'll stop there very briefly on the sample. Before we get into the results, we wanted to launch another poll. And the question this time is whether or not you have been personally, if you've personally been affected by misinformation, and I think thinking specifically about health information before. So just seeing in the chat, someone said yes recently, and it had a huge impact on them. I can't tell if we're still waiting for results to come in.
There's still people voting at the moment.
Okay,
so
great.
If we give it a second and
Absolutely.
then give it 2 more seconds, Eugene, and then I think share, we're up to 85% of people who voted now. So perhaps if you'd like to share now.
Okay, very interesting. So 37% of kind of everyone on this call said that they have been personally affected by misinformation, and 20% are unsure. So that's, I think, quite staggering. As a survey researcher, I would say that's quite significant. So thanks for sharing that. And I think it's a good springboard to get into the results. So our first finding from this study was that overall, adults in the UK are struggling to access health information that they can trust. And I think in the chat already, we've seen some discussion around that. So if we go ahead to the next slide. So we found that 7 in 10 adults in the UK said that it was easy for them to find health information online. However, less than half, or 45%, felt that they could trust this information. And, you know, while 7 in 10 people felt, yes, I can find it online, I think it's important to highlight that that still means 30% of adults in the UK don't feel that they can easily find this healthcare information on the internet. And we can then look at the next slide, looking at offline information by comparison. So when you compare the sentiment toward online information to offline information, I think we could see clearly that offline information is much harder for people to find. So only 1 in 4 adults in the UK felt that they could easily access this information. But when you compare it to online information, offline information is slightly more trusted. And I also wanted to note, as someone said earlier at the first poll, kind of the ease of accessing information depends on who you are, and we found that that's absolutely the case here. And for older adults in particular in the UK, it's difficult to find and trust information both online and offline. Our second finding was that while healthcare providers are the most common sources of information, there are signs of lack of trust in them as well. So if we go to the next slide, I think we can see here that, you know, unsurprisingly, adults in the UK are most likely to go to their GP for health information, followed by either an NHS website or a search engine. I'm sure everyone's heard the Dr. Google joke many times by now, but there is a reason for that. It's a very commonly used source. But we also saw that levels, oh, sorry, if you could just go back to the slide I was on. Thank you. We do see that levels of trust in GPs clearly differ when we look across ethnicity. And we could see that while 54% of white adults said their GP was their most trusted source, this was significantly lower among adults from ethnic minority backgrounds at 34%. So we're also starting to ask ourselves what might be behind this lack of trust. So we can go to the next slide. So we found that 1 in 6 adults in the UK said that they did not feel listened to by their healthcare provider, and this was up to 25%, or 1 in 4 among adults from ethnic minority backgrounds, which suggests a real difference in experience. And we also saw this to be more significant among adults in the UK without a degree compared to those with a degree level or above. And if we have a look at the next slide, we also found that 1 in 6 UK adults said that they did not feel supported to make informed decisions about their health. Again, this was significantly higher, up to 20% among ethnic minority adults compared to white adults in the UK. We also wanted to note that the lack of ongoing information provision may have a role to play in kind of the feelings of lack of support and lack of trust among some adults in the UK. So you can see on this slide here that nearly 20% of UK adults with a long-term condition, so that's 1 in 5 adults with a long-term health condition, had not received any information from their doctor since their diagnosis. Of those who did get information, the most common types were around treatment and prescriptions, which is not surprising, with a small number of people receiving any information about support groups or condition-specific patient organizations or charities, all of which we know have a potential to play in terms of bolstering health literacy and confidence, but it's clear that these resources are really underused at the moment. So I think this gave us a clear message that there's a real need for trustworthy, accessible, and easy to find information, particularly for those who are living with a long-term health condition. So going back to thinking about kind of the online versus offline difference, on this slide, we can see that online information was seen as easy to use and understand by about 62% of UK adults. But we do think it's important to note here that this is higher generally among younger adults and those with higher levels of education. And again, this leaves still nearly 40% of UK adults feeling that they cannot easily use online information, which is generally more accessible to them. And then if we look at the next slide, by comparison, just under half of UK adults said that they found offline information easy to use and understand. So again, a really clear gap here in terms of easy to use information for UK adults, both online and offline. In addition to challenges accessing and understanding health information, we also found that 1 in 10 UK adults say that they've been affected by misinformation online relating to their health, and this was up to 1 in 5 among ethnic minority adults. And nearly 1 in 10 adults said that they had been affected by misinformation offline relating to their health. Again, this is higher among ethnic minority adults, but I think if we go back to our poll, in this group, it was even higher. So I think there's a really clear signal here that misinformation is rampant and it's having a real impact on people's lives. And very briefly, as we said, we did this research across the 4 nations, and in our full report, which you can download now, you can look at the splits by the 4 nations on all of our questions. But in the presentation today, because we're short on time, we did just want to highlight one important point, which was looking specifically at misinformation across the 4 nations. The discrepancy between Northern Ireland and the other 4 nations, where we can see that using offline information here, 1 in 5 adults in Northern Ireland reported being affected by misinformation compared to 8% of the UK overall. So moving on to our final finding. So we know here now there's a clear need for quality healthcare information, both on and offline, but we also know that people find it easier to use online information. So this points us to the fact that there's a real need for verification of quality online health information so that adults with long-term health conditions can feel confident in the sources that they're using. So one of the things that we found was that patient organization websites were among the most trusted sources of information for adults with long-term conditions, and the majority of people who use them find it very easy to assess whether or not to trust them. Then going to the next slide, we can see here that the vast majority of UK adults with a long-term condition, 8 in 10, agree that having access to trustworthy information would help them manage their condition. Again, probably not a big surprise here, but really just underscoring how important this is. So again, it wasn't too surprising to us to see that 2 in 3 UK adults said that having an independent verification of health information would help increase their trust in information sources, kind of particularly thinking about the difficulty with trusting information sources online and the impact of misinformation. And then going to the last slide that I'll share with you today, we did see that the PIF TICK trust mark for health information was currently recognized by 6% of adults in the UK, up to nearly 10% among those between 18 and 34, perhaps those who are online more frequently, indicating that there is some recognition of this independent verification tool, but there's still ample opportunity for its use to grow. So I will leave you there with results and hand over to Sophie.
Thanks, Becca, and thanks for sharing the results. I can see some questions coming through in the chat, but we'll take all of those at the end of this presentation. I think it's, Sue said we made the first, this is a follow-up report from a report we published, Is Knowledge Power, nearly 10 years ago. And some of these recommendations are similar and indeed repeat the recommendations from that first piece of work. But I think what is different now is the scale of misinformation, but also the growth in digital and digital NHS challenge, channels which really give us the opportunity to much better integrate health information and signposting into people's health and care journeys. So our first recommendation really is that right to health information is activated, that right that people have to health information, they get that information that they are entitled to, and it is really provided as a core part of patient care. As we've mentioned already, 1 in 5 people with long-term conditions had no information from their healthcare professionals since diagnosis. And what we do know about health information is that people need that information along that healthcare journey. It needs to be the right information at the right time, whether that's a surgical intervention, whether it's maternity care, or whether it's life with a long-term condition. You need different information as you go through that pathway. It's a real key intervention for improving outcomes. And as we've seen from the results, people want that information to self-manage, to self-care. And we had another survey published by our partner, Self-Care Forum, which really looked at the self-care end of the spectrum. And again, that really showed that people want that information to be able to manage their health. We know that the use of personalised learning platforms can really be expanded as a key lever to empower people to take care of their health. People live with their long-term conditions, or indeed their pregnancy or their wait for surgery, on their own. They're not seeing healthcare professionals through their journey. So if they can have helpful information and support to help them manage that condition, but also have a way back into care when they need it, that's really important. And in the report we've published today, you'll see some examples of how this has worked and the impact. There are examples from Diabetes UK, from NRAS, who are member organisations, but also from Cognizant Group, who have produced some really clear companion information for people with long-term conditions that's really helped them manage their condition and reduce the sort of burden on NHS services. But as a very minimum, we really think the national NHS apps in certainly eventually in the 4 nations really should be signposting people with long-term conditions to national patient organisations that can provide that support. There's an opportunity with people's diagnoses to embed this, to take that burden off healthcare professionals to provide the information and to hold this information and just embed it, make it a standard part of people's care so that it's signposted really easily to the majority of people who can actually access that tool. Next slide, please. We also feel it's really important to tackle misinformation, and we think right now the most effective way to do that is through effective signposting and robust content standards. We all agree that there's a huge role for information literacy and health literacy, but that's going to take time. And actually what we're seeing is that, young people are actually looking for content standards perhaps more than older people. So we really need to promote these. We launched PIF TICK in 2020, and we co-created those content standards for high quality health information with our cross-sector membership. And we've reviewed those standards twice already in that short time to keep pace with development, most recently to include the management of AI in health information. We subject those standards to external scrutiny as well, and we're really pleased that we've had national and international endorsement. The NHS has based its voluntary content standard on the PIF TICK. The YouTube Health Shelf uses the Academy of Medical Royal College's standard for social media as a kind of prerequisite to get on that platform. And again, that is based on PIF TICK. Oh, sorry, can we go back a slide, please. And another one. And another one. Thank you. And we've also been cited as a good practice example by WHO's toolkit on tackling misinformation. We are really confident we have a robust standard, and we're confident in our assessment process. Every organisation that is assessed under PIF TICK has a robust assessment annually, and after a certain period we will start of assessing their information production process. We will do information assessments to check those processes are being applied. On that basis, we really feel there should be a national green light for NHS services to signpost information certified by PIF TICK. They should feel confident in that in that level of information, that it's accessible, that it's user-friendly, it's evidence-based, it's been developed with its users. And this will allow NHS organisations to focus on those areas of greatest need in their own communities. And we had a member from an NHS trust at an event recently saying how pleased she was that her breast cancer team had said they're now going to use Breast Cancer Now's information, and she felt really confident in that because it had the PIF TICK. We're also really pleased that we'll be working with NHS England and the Library Service to work with the Public Library Service to sort of promote NHS login, and also the toolkit will include the PIF TICK directory so that librarians can help signpost people who might not have internet access to trustworthy sources. So next slide, please. We've seen clear inequalities coming through in our results, and fundamentally part of our criteria is a criteria to tackle health inequality. If we really believe that health information must be accessible and appropriate for all, that's the everyone that is at the very front of our vision. And we really want national governments to support the development of a health literacy friendly NHS so that everyone can have information and support. Now, some of this includes actually working with stuff that's already there, like the Accessible Information Standard, which is now hopefully hopelessly out of date with modern technology, and we're still waiting for the update. I think it was last updated in 2015. And I think when we think about the availability of digital technology, it's easy to forget that people are still being given really inaccessible information. I had a really vivid reminder of this yesterday when I was at a conference about consent. And a patient advocate who was presenting some qualitative data about patients' experience of consent had actually, in the previous fortnight, had an experience of consent herself. She's partially sighted, and she had on the lectern the really badly photocopied black and white leaflet that she'd been given that she couldn't read. There wasn't an electronic version available. There wasn't a large print version available, so she just had to take it home and use a magnifier to try and read this really important consent information for surgery. I think that's completely unacceptable in the modern age. So we need to see this accessible information standard absolutely enforced and updated now. We'd also like to see the NHS content standard, which is a voluntary standard, mandated. And I think the most important element of that standard is the reading age target, which is to aim for a reading age of 9 to 11 for health information. We still see far too much health information that is too complex. And we know that skill levels in the UK, both for numeracy and literacy, are quite low. While we look at the acceleration of digital, we need to make sure that people aren't left behind. So we need to look at printed information and face-to-face care for people who are digitally excluded while working to remove those digital exclusions. And there's many ways we can look at that. We see lots of organisations working through the Public Library Service. There's a real opportunity with the new hospital programme to embed the delivery of health information. We have a brand new hospital in Brighton that's got a walk-in health information centre and a lovely internet cafe where people can go in and access health information and get online. I've noticed in the chat that people are talking about translation. Translation is absolutely key. Sometimes there is an absolute need for bespoke specific translations to meet people's needs, but we're seeing more and more PIF members take advantage of the advances in technology and embedding translation onto their websites with appropriate disclaimers. We've just published updated guidance on translation, and that is available on our website. I think what was really interested in the launch presentations we had last week was the user acceptability testing the British Liver Trust have just done on their machine translation tool. And the overwhelming message from their user panel was go for it, because used with appropriate disclaimers, is allowing people to access information. We also want to see training and information provision for healthcare professionals right across the skills mix, because that skills mix is expanding, and we're going to see a bigger skills mix as we move from hospital to community services. And I think the other piece, which I think is really important, is we understand right now there's a capacity crisis, but we need to make sure that that capacity crisis doesn't stop NHS frontline staff delivering that compassionate care with cultural competence and understanding those differences. I think one of the things I saw also yesterday at the consent conference was that in Wales they are doing a kind of peer review of consent. So they're getting data on consent, but they're also peer reviewing the consent process and seeing how they can improve it to make sure that people are properly consented and able to firstly take part in shared decision making, and then take part in consent. Next slide, please. So we think it's really important that that lived experience is a bigger metric, that patient experience is a real measure of performance of the NHS. And we've got the opportunity to do this now through national digital tools. We really would like to see that being used to track progress on things like access to information, being listened to, being involved in decision making, and being treated with dignity and respect, because I think the data we've produced today shows that that is not a universal experience, and it would be really great if we can improve that, and the only way we can improve that is by having the data and having that built into planned ecosystems and having that data fed back locally. One of the things when we did a piece of work last year with the professional record, with the Patients Association, and we did a co-production project in Nottinghamshire, we know that sometimes healthcare professionals struggle to have those conversations, but what we found was the very simple About Me standard that the professional records bodies, standards body established, really facilitated those conversations and broke down the barriers. Now we know in Wales they're trying to build that into the NHS Wales app. We would really like to see that built into all personal health records and NHS apps, so that those conversations, the things that matter to the person, really come to the fore. So next slide, please. Have to excuse me, I'm losing my voice slightly. This is probably the recommendation that lines almost perfectly with the first report. We really need to see dedicated leadership at local level, and that those local leaders are given a mandate and resources for the effective delivery of health information. That's always important. That has always been important. But if we are really going to be successful about transferring care from hospital to community, it's going to be fundamental. It's going to be a huge issue for patient safety and access to care. So we really want organisations to have that dedicated lead. We want them to be resourced. We think this is something, at the moment, the Care Quality Commission is best placed to look at and to enforce, and to really make sure that these mandatory legal requirements like the Accessible Information Standard are actually met. But as well as providing health information, we really want the impact of that information to be measured. And that, so if we have this digital ecosystem, can we find the interventions that work? What is the impact? What is the difference? Because many of us providing health information have tried to measure this, but it's a really difficult thing to actually isolate the impact of the intervention amongst other factors, although there is lots of positive evidence out there. And what we would like to see is that a do it once and share approach is adopted to effective interventions. Now, we've seen many effective interventions, both nationally but also locally, so that these can be rolled out where they work. So there are some things that immediately spring to mind. So I think South Yorkshire NHS Trust did some very specific translated resources co-produced with the South Asian community for respiratory health. They've been effective. They're a BMA award-winning resource. It'd be great if those could be shared and tweaked for use elsewhere within the system. That's just one example. But I think if we can just find these interventions at work and share them, then that makes it easier for everybody. We need to keep the local nature of the NHS, but we also, and it's really important, I think, for tackling some of the prevention agenda, that we work with communities to find out the solutions and co-create the solutions for sort of positive health interventions. But we need to share those interventions when they work and not reinvent the wheel everywhere. And fundamentally, we think that the development of a health literacy friendly NHS that people can navigate with confidence, manage their care with confidence, should be a national priority to support health. So those are our recommendations. And before I run into the last slide, I'd just like to run the final poll, please, Eugene. And now that is saying, it's a repeat of the question we had at the beginning to see if there's any difference now you've heard our results. So I think the proportion who are saying it's hard has gone up from what I can see so far. So if you would just like to share that. Oh no, still people voting, so I will leave it for a second. I think one thing I will say while we're talking is we did this while we're waiting for the poll research, the poll to finish, is that we ran this research in June, was it, Becca, I think? And since August, we've had the advent of Google's Gemini search summaries. And what you see now is you get a Google AI summary of whatever your question is, and the links to those NHS organisations or charitable organisations providing health information come lower down the page. And we're already hearing from our organisations that that is impacting their traffic. So I think even since we did the survey, possibly it's become harder to find those organisations. So can we stop? Could you share the poll now, Eugene, and we'll see what people are saying now. Brilliant, thank you. Okay, so my last. So yeah, so I think the proportion of people who think it's hard has now increased. So hopefully we can do something about that and make it easier to get the information into the hands of people who need it. So as part of that, I would just encourage you all to be part of the change. PIF TICK was created to help public quickly and easily identify trusted health information, and we try to make the creation of accessible content business as usual via our criteria. There are 10 criteria, and each is supported by best practice guidance. So please signpost the PIF TICK to people accessing health information. And also, if you are a producer of health information, have a look at the PIF TICK and see if it will work for you. We also have a health and digital literacy charter, which more than 100 organisations have signed up to, which commits organisations to being health and digital literacy friendly in their approach. And again, we'd encourage people to have a look at that and see if they can become part of that. And join us to get in touch and help us make health information accessible for all, because that's our goal. So thank you. And I think we'll move into questions for the panel now.
Are we going to stop showing? Yes, we're going to stop showing the slides. Dan, I think you are our quiz master, aren't you?
Yeah,
the questions.
between myself and Virginia, I think we've tried to note as many of the questions down as possible. So, Rebecca, if you don't mind, I would like to start with the questions that we had for you.
Sure.
So the first question is, how was misinformation defined? And they're interested to understand more about the online-offline split as well.
Mm-hmm. I actually have the questionnaire on my other screen here, so I can answer this very confidently. So we worked on this definition for a while. As you can imagine, it's a tricky one to kind of nail down. But what we said was, by misinformation, we mean incorrect or misleading information, which may exist without specific malicious intent. For offline, we just gave some examples, including booklets, leaflets, or newspapers. And for online, we said could include social media or condition-specific patient organization websites. So I'm sure, not a perfect question, probably not a perfect answer, but we felt that kind of best encapsulated what we were trying to understand.
Lovely. Thank you very much. And how did you define what was covered by offline in terms of, was that healthcare professionals, friends, all of those kind of things in and around that as well?
Yeah, I mean, exactly that. It was, yeah, it could have been, again, I'm trying to scroll, but yeah, generally a healthcare provider, anyone you're having a face-to-face conversation with, a leave behind material that you're picking up, could be a poster, really kind of any kind of information source that is not available, not on the internet versus one that was.
Virginia, was there any others that you spotted for Rebecca? You want to go through those?
Yes, thank you. So there was a question that asked, so is the misinformation targeted at ethnic minorities or people in Northern Ireland, or is there a different perception of what misinformation is?
That's an excellent question, and one that I can't truly answer. I think I'm already thinking of a follow-up study, but the way that I would interpret that is not our data cannot say whether or not it's being targeted, but it is being experienced more by people from ethnic minority backgrounds, by people living in Northern Ireland, for example, from those results. And kind of the why that is really, what we would need to unpick more. So it's a great question, and one that I think we would like to look into to understand better. But yeah, from the survey, the way to understand that is their self-reported experience is higher.
We've just had another question pop in for you, Rebecca. Was ESOL defined in the ethical categories? We find poor translation, Google Translate and AI, etc., is a big one for us.
Can you ESOL? I'm not familiar with the acronym.
I'm not either. I'll just
English as a second language.
Thank
perfect,
you.
thank you.
I'll be the translator. Sorry.
Understood. No, that's fine. So it is currently not an option in the survey as an ethnicity category. So that would not have been captured under ethnic minority versus white. So that wouldn't be covered in that question. But it's a very good question and something, again, that is important to capture, definitely.
I don't have any more questions for you, Rebecca. Virginia, do you have any more?
Rebecca a question, Dan?
Yeah, of course you can.
The thing about white and ethnic is there's plenty of white people who don't speak English.
Mm-hmm.
Get the point, don't you? Okay, I won't.
Yeah, of course.
Keep on about it.
Yeah, no, completely understood. And again, in survey research, one of the challenges we have is how do we categorize people, and it's imperfect and it's not reflective of everyone's lived experience. So absolutely take your point.
Lovely, thank you. Sophie, over to questions for you now. So we have a question here about making every contact count. Was a seminar that somebody was at recently, and they've said that there was quite a lot of overlap here with what we've got. And how would we ensure that all services are using PIF TICK information as a standard?
Well, we would love that, obviously.
Yeah.
And I think we it's just about how we can embed that within the NHS and get the NHS to start signposting that across the skills mix. I think we also have to accept that there are members of ours that are providing fabulous information who are not yet PIF TICK accredited, but having the PIF TICK does give the assurance that people have been properly assessed against a standard by us and that they can have some faith in that. So I think given the kind of endorsement, we would just really like to encourage the NHS. It's over to the NHS really to say, embed PIF TICK information so that people can access it and have that support.
Lovely. We have another question here about buy-in from people. So how do we get buy-in from people who may be less familiar with this area? It often feels like we're talking to the converted, but need to engage people who will not even think about this as an issue. So I don't know if you have any thoughts on that, Sophie.
If we're thinking about the sort of provision of health information as an issue, is that the question?
Yes, exactly.
Well, I think, we've got there's clear evidence from this survey and from the survey that the Self-Care Forum published last week that actually people really want this information. They really want to be able to look after their health. And it's difficult. And I think it's particularly important when we know that there is a capacity crisis in the NHS and it is difficult for people to access services. So they particularly do need that information. We also know that health literacy is it's a challenge, and there's great data as well from the Self-Care Forum last week found that 50% of people are really struggling to make treatment decisions. It's the biggest health literacy challenge. So I think it's almost a redundant argument that people need health information and support. Sue, you've got your hand up.
I was going to come at it from the perspective of what can we do to kind of get buy-in and influence others. And I think one of the pieces of work and the opportunity that exists for us is the current consultation with NHS. And I think, Peter, you asked a question, what are the 3 key things that PIF would put into our response? And I think that's really good because we've got lots of recommendations, but I think if we want to focus minds, then we need to prioritize. So I think that's still a piece of work that we're looking at, and we've got limited time because the deadline is the 2nd of December. But I think focusing down, less is more, and we will share that consultation back out with people.
Yeah, and we had a member engagement event on Monday just to kind of gather those priorities from people. So I think we've got quite a clear steer on that now. Sue, you've got your hand up.
Sorry, could we do the last 2 questions from the chat first? So, I've got balloons, sorry.
That's lovely.
So one question was, have you any plans for, or is there any qualitative research which aligns with these insights in order to understand barriers and enablers further, particularly for different marginalized groups? And the other question, which is quite similar, have any evaluations been undertaken that demonstrate the impact that having had access to good information has had on people and their healthcare journeys or outcomes compared to a control group? So further research, and is there anything that currently exists to show that good information has impact?
Quickly, I think that's the area we'd like to do some further research, and Rebecca and I have been talking about this already. And we did try to do, we tried to do a survey. We did a big PPIJ project at St Mark's and the IBD service, where people were assigned to a kind of health information pathway where they had an intervention or not. But actually, when we got to the ethics approval, we decided it was not ethical to give some people an intervention and some people not an intervention, which could improve their health when there was no risk with the intervention. So actually, we didn't do that because it wasn't ethical, and I'm not sure it is. So that was the answer on that one. So yeah.
We've got quite a few hands up now.
Just very quickly, just to follow on from what Sophie was saying, I think there is quite a lot of information that exists about the positive impact and how that can deliver positive outcomes. And it's something actually I think PIF could possibly bring together from all of our associated patient organisations and other providers, because I think we could pull that report together, because I know that work has already been done.
Yeah. Sue Lacey-Bryan.
Hi, hello.
Hello.
Just on that point, my colleagues who sit on a National Health Literacy and Digital Literacy Partnership be very happy to contribute to that piece on the knowledge base. We too have looked at the evidence base behind that. If I had one thing I'd really like to see going forward around this is for the NHS itself to commit to becoming health literate organisations. I think there's the most enormous amount we could do through that approach. So just in a nutshell.
Yeah, I agree, absolutely. That will be one of our recommendations, particularly with the changes to care. It's really important. I think there was another raised hand, was there not?
I've got a question from the chat.
Okay.
As well. So when dealing with a rare medical topic, how does the PIF tick assess whether the info provided is truly accurate and evidence-based? Any organization could claim to check papers, etc., but in a controversial area, who is the arbiter of what is truly evidence-based and balanced?
Dan, do you want to take
Well, I was just going to say, would you like me to take that one?
Yeah.
So as part of the PIF tick assessment, we would look at the experts that you select, the qualifications that they have, and the research that has been conducted. The process that we look at, for those of you that know about the PIF tick, is we look at the process you go through, not the individual pieces of information. But as Sophie alluded to at the beginning of this, we do also do information assessments. So we will be taking examples of those rare conditions, and we will be doing our own checks against that to make sure that these information is balanced, it is up to date, it is trustworthy, by going to various different medical sources. We don't take any information that people give us at assessment at face value, as bad as that may sound. We like to dig in and understand exactly what is going on. So we will be testing the experts. We won't just accept Dave's an expert because we like him. There would be much more in-depth digging around who is Dave, what's his background, where do they come from, what qualifications do they have. And at the end of the day, if there is conflicting views or different ways to look at things, we would expect you to give a balanced account of that. That's part of the PIF tick. We know that there isn't always a black and white answer. So you have to be very clear about the sources that you've used and the information that you are portraying. For anybody that wants to go into a bit more depth in the PIF tick and the way that we assess things, I'm more than happy for you to drop me a note and have that conversation with you.
And I just wanted to say that working for a rare disease charity, I can confirm what Dan is saying, because that the process that we go through ourselves to make sure that the content is evidence-based, accurate. It is a challenge because it's more limited, but I think the process that Dan has set out is really, really helpful for that.
Thanks, Steve. Liz Gardner, you have your hand up.
I do. Thanks very much for that. I'm a librarian in Staffordshire, and I just wanted to mention a couple of things relating to kind of how do we not just preach to the converted, how do we get the word out on the ground, which I know Gemma mentioned. And I think for us, it's been working with the National Health Literacy Partnership, which Sue Lacey-Bryant mentioned. Lots of projects around spreading health information awareness, lots of training, working with local organisations on the ground, and particularly working with our colleagues in personal, social and health education in schools to actually make sure that we're raising the issue of health information and can it be trusted, can it not, etc. In schools right from a really young age, so that the next generation is growing up with some of this already embedded in the way that they're looking at the world, and they're already spreading that into their families and into their wider community. So really it's just about that constant kind of advocacy on the ground for us, and that's where we've been kind of taking this.
Yeah, I would agree with that. Absolutely.
I think
the point about schools is really important.
Yeah, sorry, Sophie, just before we go to the next question, there was quite a lot of comments, not really questions to post to people, but comments around pharmacists and other healthcare professionals that also can play a big role in sharing information, not everybody knowing what good information is. So I think there's some wider education there as well that we can do. Peter Smith, I can see you have your hand up.
Thank you. I'm president of the Self-Care Forum, and as Sue said, we actually published some complementary research last week, which was really sort of confirmed your devastating results. I would say, as an organisation that has been PIF ticked, it's very rigorous, and everyone should go through it. But my point really is, NHS change consultations underway. All of you must be part of an organisation, and hopefully they're going to be putting in a submission to that to change NHS. If they're not, encourage them to do so. And if it says just one thing, could we make it mandatory that all NHS organisations have to go through the PIF tick process and be to actually get the PIF tick? If we can all do that, then I think we'll have made quite a significant impact on the NHS and in getting people understood.
Yeah, thanks, Pete. I think, you know, I mean, obviously we're as keen as we can be for people to follow the PIF tick, and I think the thing that would really be important, that's different from the voluntary NHS content standard, is that measurement of impact, that real emphasis on co-production. And I think that would be, you know, it would be really good to have that. But even if we couldn't have that, I would love to see that health literacy and that reading age at least mandated across the NHS, because I think that is absolutely vital, and the accessibility, that is so vital. Sue, I'm not sure if you've got a legacy hand or if it's a new hand. It's a legacy hand.
I think that is all the questions, Sophie.
Hey, brilliant. Well, the report's available on the website. I would encourage all of our members to respond. I'm sure you are responding as organisations to the NHS consultation, the change.org consultation, but you can also reply and respond as an individual. So please do that. And thank you for attending. Over to you, Sue, for some closing remarks.
Yeah, no, I think thank you. And the numbers who signed up and attended, I think just shows the passion and the interest in this area, because everybody recognises this is a core component of everybody's healthcare journey. And for me, I want the provision of healthcare information to be a key part of that patient journey. I would love that to be mandated. Now, I know it will be different for different conditions and different situations, but for that to be recognised as a core component, I think is really essential. And for all the work that you do, thank you very much, because it feels like now we have a real kind of army behind us. Not that I like to use military terms, but it feels that the support that we have is really going to take us to the next level. And I think a major focus for PIF, as a very small organisation but perfectly formed, has been on training, has been on getting the PIF tick off the ground. And we are increasingly going to be turning our attentions to advocacy and influencing, but we can only do that with your support and your help. So thank you very much, everybody.
Thank you, everyone.
Thank you.